The nature of my work means I often see people when they are already facing a difficult diagnosis. And if there is one thing I've learned in my years of clinical practice, it's that our bodies usually try to talk to us long before a crisis hits. One of the most challenging aspects of oncology, the study of cancer, is how quietly these conditions can begin. Unlike a sudden injury or a sharp infection that demands your attention immediately, many forms of cancer are incredibly subtle. They don't always arrive with a bang. Sometimes they arrive with a whisper or no sound at all. In the medical world, we often call this insidious, meaning it develops so gradually that you might not even realize something is wrong until the process is well underway. I see many patients who are proactive about their health, people who eat well and stay active, yet they still feel a sense of unease or notice a tiny change they can't quite explain. It is my job to help you understand those whispers. My goal today isn't to cause alarm or spread fear. Panic is never a helpful clinical tool. Instead, I want to provide you with the same calm, sensible sensitization I offer my patients in my office. We know that every year in Germany alone, over 500,000 people receive a new cancer diagnosis. Because we are living longer, which is a wonderful thing, the statistical likelihood of encountering this disease increases. Currently, about 1 in 2 men and 2 out of every 5 women will face this diagnosis at some point in their lives. These aren't just numbers, they represent our friends, our family, and ourselves. The reason I want to walk you through these early signs is simple: timing. In the vast majority of cases, the earlier we detect a change in the body's cells, the higher the chances of successful treatment and a full recovery. While regular screening appointments are the gold standard and something you should absolutely discuss with your primary care doctor, your own daily awareness is your first line of defense. Often, the earliest symptoms are what we call non-specific. This means they could represent a dozen different things, most of them completely harmless. Because they are so vague, many people make the mistake of ignoring them or simply waiting for them to go away. I want to help you avoid that mistake by explaining exactly what is happening inside the tissues and why certain invisible stages of change are worth paying attention to. When we talk about cancer biologically, what we are really talking about is a disruption in the body's natural order. Our bodies are constantly regenerating. Cells grow, divide, and die in a very controlled rhythm. Cancer occurs when a group of cells decides to stop following the rules. They begin to multiply where they shouldn't, forming a mass or a space occupying lesion. In the beginning, these cells are often painless because they are technically your own tissue. The body doesn't initially recognize them as an invader like it would a bacteria or a virus. It is only when the growth becomes large enough to press against a nerve, block a vessel, or crowd an organ that physical pain typically starts. By understanding this, you can see why waiting for pain is often waiting too long. Before we look at specific organs, we must talk about the B symptoms. These are general changes that affect the whole system and often serve as the first clue that the body is working overtime on something internal. The first is unintended weight loss. I'm not talking about a couple of pounds after a busy week, but a significant drop, usually more than 10% of your body weight, within 6 months without any change in your diet or exercise. This happens because the metabolic demand of rapidly dividing cells is very high. They essentially steal energy from the rest of your body. The second and third signs are persistent low-grade fevers and intense night sweats. We aren't talking about feeling a bit warm under a heavy duvet. True clinical night sweats are drenching, the kind where you have to change your pajamas or even the bed sheets because they are soaked through. This is often the body's inflammatory response to cellular changes it is trying to process. Along with this, you might feel a profound, heavy fatigue that sleep doesn't fix, or generalized body aches that have no obvious source. While these symptoms can frequently be caused by simple things like a lingering infection, a hormonal imbalance, or a nutrient deficiency, they are the body's way of raising a yellow flag. In my practice, I always tell patients that caution is better than hindsight. If these systemic changes last for more than a few weeks, it is time to have a thorough checkup. It might just be a vitamin deficiency, and I've written many guides on how proper nutrition and vitamin D form the foundation of our immune health. But we want to be sure. One of the most common things people notice is a lump. Specifically, we look at the lymph nodes. You've likely felt them under your jawline when you have a sore throat or the flu. These are your body's filter stations. They trap debris, bacteria, and abnormal cells. Normally, they are about the size of a pea and soft. When you have an infection, they swell and often become tender or painful as they go to work. This is a healthy response. However, a lymph node that swells without any pain and feels hard or fixed in place is something a doctor needs to see. Lymph nodes are located all over your body, in your neck, under your armpits, and in your groin. For example, if there are changes in the breast tissue, the lymph nodes under the arm might be the first to react. If there are issues with the prostate or lower extremities, the nodes in the groin might enlarge. I personally have had a small, permanent node in my neck for 20 years since childhood. It's a remnant of an old infection. So, a lump doesn't always mean a crisis, but as a rule of clinical practice, if you find a swelling that is larger than 2 centimeters, is only on one side, or doesn't go away within 3 to 4 weeks after a cold has passed, you should have it looked at. An ultrasound or a quick clinical exam can often provide immediate peace of mind, or it can give us the head start we need to protect your health. Moving beyond those general physical signs, we need to talk about the largest organ in your body, your skin. In my years at the clinic, I've found that the skin is like a map that reflects what is happening deep inside. Most of you are likely familiar with the ABCDE rule for moles looking for asymmetry, irregular borders, or dark colors. This is vital, and I personally go to a dermatologist once a year for a professional screening because skin cancer is something we can often catch just by looking closely. However, there are other more subtle changes that people often overlook because they don't look like a typical mole. Sometimes a sign of trouble isn't a dark spot at all. It might be a persistent, non healing wound, a small sore, or a scaly patch that stays for weeks and just won't seal over. Other times, you might feel a hard lump or a thickening just beneath the surface of the skin. Even a change in your overall complexion can be a clue. For instance, if the skin becomes unusually pale, it might indicate a low red blood cell count known as anemia. While this is most commonly caused by simple iron deficiency, in some cases, it can be a sign of how the body is reacting to conditions like leukemia. It is all about the total picture. We look at these skin changes in combination with how you are feeling overall. From the skin, let's move inward to the digestive tract. We all experience an upset stomach or a bit of bloating from time to time, and usually it's just something we ate. But as a doctor, I look for patterns. If you notice a change in your bowel habits that lasts for several weeks, perhaps moving between constipation and diarrhea without reason, it's worth investigating. One of the most significant red flags is blood in the stool. Now, I often tell my patients not to panic immediately, as this is very frequently caused by something as simple as hemorrhoids. However, we can never simply assume that. It could also be an early sign of colorectal cancer. The digestive system is a long, complex tube, and symptoms depend on where the change is located. If you find yourself feeling full very quickly after only a few bites of food, or if you are experiencing frequent, unexplained nausea and vomiting, your stomach or gallbladder might be trying to send a signal. Chronic pressure or a feeling of heaviness in the abdomen is another symptom that shouldn't be ignored. These signs are often non-specific, but identifying them early is exactly how we successfully manage conditions of the stomach, intestine, or pancreas. We also have to consider the air we breathe and the way we swallow. A cough is a very common reflex, but a quality change in a cough is what interests me clinically. If you have a dry cough that simply won't go away after 3 weeks, or if a smoker's cough suddenly starts sounding different or more intense, it's time for a chest x ray or an exam. The most serious warning sign in this area is hemoptysis, which is the medical term for coughing up blood, even just a tiny streak in the phlegm. This is a direct signal from the lungs that needs immediate professional attention, as it is a classic early indicator of lung cancer. Similarly, we look at the throat and the voice. If you notice, persistent hoarseness, the kind where your voice sounds raspy for weeks without a cold, or if you feel a lump in the throat when swallowing, we need to check the larynx and esophagus. Now, I often have a slightly hoarse voice myself after a long day of talking to patients or recording videos, so don't be frightened by a temporary change. But when these symptoms become chronic, or if you feel a persistent shortness of breath while doing activities that used to be easy, your body's asking for a closer look. Finally, in this section, we must touch on the nervous system, our brain, and spinal cord. Because these organs control everything from our movement to our speech, the signs here are often functional. This might include new persistent dizziness or a sudden change in your vision, like blurring or seeing double. In the clinic, we are particularly alert to first time events, such as a seizure in an adult who has never had one before, or a sudden weakness or numbness in an arm or leg. It is very important to distinguish between a slow growing issue and an emergency. If these neurological symptoms, like a drooping face, an inability to speak clearly, or sudden paralysis, happen within seconds or minutes, you are likely not looking at cancer, but a stroke. That is an absolute medical emergency. In that case, you must call 112 or your local emergency number immediately. Time is brain tissue, and every second counts. But for symptoms that develop more slowly and linger, we look toward a different kind of diagnostic path to ensure there isn't a space occupying growth affecting your nerves. Finally, I want to discuss the symptoms that are specific to the reproductive organs, as these are often the areas people feel most hesitant to talk about. In my practice, I've seen that many patients delay seeking help for these issues out of shyness or a hope that the problem will simply resolve itself. However, because organs like the breasts, prostate, and ovaries are so biologically active, early detection here is incredibly effective. For women, it is vital to stay vigilant about breast health. Breast cancer remains the most frequent cancer diagnosis for women, and while many cases occur later in life, it can also affect younger women. Beyond just feeling for a hard, painless lump, you should look for other physical changes. This includes any unusual dimpling of the skin, which can sometimes look like the texture of an orange peel, a nipple that is newly turned inward, or a noticeable difference in size or shape between the two breasts. Moving to the lower abdomen, pay close attention to your cycle. If you experience bleeding between your periods, or if you have gone through menopause and suddenly start spotting again, this is a clear signal to visit your gynecologist. Unusual discharge that is persistently mucousy or has an odor, especially if accompanied by a dull, heavy ache in the pelvis that feels different from normal cramps, also warrants a professional checkup. For the men listening, we have our own set of priorities. Prostate cancer is the most common form of cancer in men, but I also want to speak specifically to the younger men between the ages of 15 and 45. In this age group, testicular cancer is actually one of the most frequent serious illnesses. Because young men often feel invincible, they might ignore a slight pulling sensation, a feeling of heaviness in the scrotum, or a small, hard knot on the surface of a testicle. My advice is simple. Just as women are encouraged to check their breasts, men should briefly palpate their testicles regularly, perhaps once a month in the shower. It takes seconds and provides a baseline of what is normal for you. When it comes to the prostate, the signs usually appear when we go to the bathroom. You might notice that your urge to urinate increases, especially at night, or that the flow of urine feels weak or keeps stopping and starting. You might even see a bit of blood in the urine or the seminal fluid. Now, it is important to remember that as men age, the prostate naturally grows a condition called benign prostatic hyperplasia. This is not cancer, but it causes very similar symptoms. Only a doctor can tell the difference through a simple exam or blood test. So don't sit at home wondering which one it is. The underlying message I want to leave you with is that none of these symptoms on their own are a definitive diagnosis of cancer. The human body is complex, and as I often see in the clinic, these signs are frequently caused by inflammation, harmless cysts, or just the natural process of getting older. But if a symptom is new, if it is persistent, or if it is atypical for your body, that is the moment to act. I've spent my career advocating for prevention over reaction. Many of the most effective screenings, like a colonoscopy, can find and remove precancerous changes before they ever become a problem. I personally had my first colonoscopy at 42, even though the standard insurance coverage in some places doesn't start until 50, because I value that peace of mind. Taking charge of your health isn't about living in fear. It's about having the information you need to live a long, healthy life. Talk to your family doctor, ask about the screenings available for your age, and never feel like you are bothering us with your concerns. We would much rather give you the all clear today than see you in a difficult situation a year from now. If this video has been useful to you, please give it a like, subscribe to the channel, and turn on the notification bell. Help me reach 50,000 subscribers so that more people can receive this information.